Hello, everyone. I am Gina Vega. I am the membership director at the BACD, and I've been a dentist for over 25 years. So a little bit about myself. I am from Mexico. I qualified in 1998, moved to the UK in 2001, and requalified to become a dentist over here. And I am very privileged to be able to say that I practice dentistry, private dentistry here in the UK since 2008. In 2010, I bought Bishopsgate Dental Care, a multi-award-winning dental practice in the City of London. So I have been around in dentistry for a long time. And therefore, for me, the natural step was to try to change things in dentistry. And that's why I joined the BACD, as I think is an amazing academy. There is lots of opportunities for socializing, lots of opportunities, obviously, to see amazing speakers, international speakers, and British speakers. So I am being at the board. I sit at the board of directors for the last 2 years, and I love being the membership director because it gives me the opportunity to bring amazing benefits to our members, and Kiroku is one of those amazing benefits that I want to talk to you about today. So I'm going to share my screen now. So I know Hannah for a while now, and when she introduced Kiroku to me, I was just taking over the role as a membership director, and I was very curious. I wanted to know what is this about. You hear about it through other colleagues, and I thought, okay, what is special about Kiroku? Will it be the same thing as having some templates and you copy the templates into your notes and you just be adding your other information? But amazingly, Kiroku make things even easier than copying your templates and putting them in your notes. So basically, when you sign to Kiroku, you're going to come to this page. There is a home page. As you can see here, for example, at the top, you will see that I have done 636 appointments completed with Kiroku. I have said 82 hours of writing notes and working on my notes. So I'm very happy about that. And normally I use a lot of Kiroku to do my basic examination. I do a lot of Invisalign assessments with it. And on the bottom here, I would like to show you our BACD consultation template. So basically you sign in and you will see this screen. The great thing about this is that you can access it from any computer. You don't need to carry your telephone in an app. You don't need to, you just sign in whatever computer you are, and you will access your templates, okay? So let's start. So let's imagine we have a new patient coming to the practice, or a regular patient coming to the practice. The first thing is obviously you want to put the initials of your nurse. For example, I have 3 here. Unfortunately, we've been lacking a good nurse for a while, so we do see a lot of temps. So that's why I added this button here. So let's imagine I'm working with Cici. That is my lovely nurse Cielo. And then we ask the questions to the patient. The patient came to see us a year ago. They have some pain. They mentioned that is on the lower right quadrant, say that it's been going on for 5 days roughly. He feels that it's sharp. There is no radiation. He feels alleviated with painkillers. So you basically just start pressing the button that is actually writing the notes for you at that moment, okay? So we just go along, say that he's having some painkillers, he's not interfering with sleep, and they said, but probably it's about 6%. So then it takes you to your medical history. At this point, I obviously ask my patients, are you fit and healthy? Do you take any medication? Are you allergic to any medication? Then we go into the social history. Let's say it's not a smoker and it drinks the average under 14 units per week. And then we go into the oral hygiene. Okay, so let's say there's a good patient, you use an electric toothbrush twice a day. We then ask them about the toothpaste, if it's something that you want to ask. Let's say that you don't want to ask about it. The toothpaste is something you don't want to. You can edit your template, or you just delete that line, okay? So the patient is not cleaning interdentally and the sugar in the diet is moderate. Please be reassured that you can add other buttons. So if you want to talk about acid in the diet, you can also add it, and it will be very simple to do. So now we're going into the extra oral examination. Let's say that the patient has a cold sore. There is some clicking on the right side. The patient doesn't feel any pain. Then there is no other problems or nothing to note on the extraoral examination. We then go into the intraoral examination. Okay, let's say it's a patient with a class 2 deep 1. The shade of the teeth is an A2. Let's see that the patient has linea alba and a scallop tongue. You put it in your notes. The patient is a grinder, and we realize that. So we see that there is some tissue loss that is localized, that is moderate. We're going to say that is attrition, and it's in the anteriors, okay? Then let's say that we have one area, one upper left 3 that has some gum recession. So you just put that there. You do your BP, and the highest score is a 2. The oral hygiene is moderate. We find that there is some decay in the upper left 6, for example. Actually, we can say lower right 6 too, because he did say that he had some pain on the lower right. So we notice that is a crown on the upper right 6 that is deficient, is leaking. So we can add it into our list of problems. There is no implants present. Let's say that the patient has some mild crowding on the upper and lower, and you potentially going to discuss Invisalign with them or any other alignment treatment that you do, ortho. Then you could say, mention it to the patient at this point. Have you thought about straightening your teeth? Say, no, I have not. I'm not interested. Then you can just say, patient is not interested. They may say to you, well, actually, I had braces when I was a teenager. So you just put a note on that. Okay. Then you're doing your checkup. You know there is some pain. You're obviously going to take some x-rays. So you just take a couple of bi-wings. So we're going to say that the grading is an A. You notice that there is some decay on these teeth radiographically. Then you check probably about 10% bone loss. And then you can put here, okay? Let's say that there is a deficient restoration in the upper right 6. So we put that in our other findings. Then, because the tooth has been painful, we want to take a PA. So let's say that we take one PA. We have the lower right 6 is the one that we take in the PA. The grade is an A. You know that there is decay. You notice the decay there. You just put it in there. The tooth is not, has a root canal. There is 10% bone loss. And let's say that there is no other findings that you want to add to that you've seen on your x-ray. Okay, and in this case, an OPG is not indicated. So then this is when it becomes quite interesting, because what is going to happen here is some of the diagnosis is already going to appear. So, for example, if you know that there is some the pulpitis is reversible, you put reversible pulpitis, add it to your treatment, then you put that is on the lower right 6. Okay, then we talk about the gums. and we noticed that actually it's not too bad. It's just localized gingivitis. He has some localized calculus. And here is already your diagnosis, okay? So you have put everything that you have already charted is already in your diagnosis. And this is when this Kiroku software becomes very, very interesting, because when you're going to then discuss all this with the patients, but is the writing and the copying and pasting constantly that takes a lot of time. So in this case, when we are going to be discussing, starting with the discussions, for example, we noticed the patient didn't use floss or interdental brushes. So we said here that we advise them to start flossing. Then you're going to talk about the decay that was present in their mouth. Then we're going to talk about the restoration that was leaking on the upper right 6. So you're going to see it here. And then we're going to talk about the gingival, or the gingivitis, or the gum health, okay? Then we move down, and we know that we want to do a crown on the lower right 6. Then we want to do a filling on the upper right 6 and the upper left 6, I think it was. So you put here whatever you want to do, and then you just add it to your list, okay? We know the patient needs to come and see the hygienist, so we're going to put that in our treatment plan, okay? So in this way, you are basically finalizing your notes. In this case, for example, I put caries low. I shouldn't have done that. So what I do is I go to undo, and I put that is moderate or medium. I know perio is only a little bit of gingivitis, so probably is low. He has some tissue surface loss. And then we want to see the patient every 6 months. So we press here and voila. So we go up, and you can check everything that you've written down and make sure that you're happy with that. You can add notes. For example, if you want to note here that the patient has a lesion on the lip, when you just put lesion on the lip fossa, lower left, you can describe how it is. So it's basically just by pressing enter, you add a line. You can delete the line as you wish. And this is how easy it is to do your notes. Here at the top, you're going to find this button that says copy notes, and they are copied. And it's as simple as to just paste it on your dental software. So it is super, super easy to use. Another template that I want to show you is, okay, so if you finish with this one, what you do is you go into your select your next appointment, or simply you go and, sorry, let me just move this down a little bit, Kiroku, or you can just open a new tab, and then you just open a new window. Let's say you haven't had time to finish these notes, you can start other notes in another window, okay? So I do a lot of Invisalign. The great thing about Kiroku is you can edit your templates as they suit you. So if you don't want to do a very extensive ortho assessment, you don't have to. If you want to go even more extensive, you can do that as well. So it really, really depends on what you want to do. And learning how to edit is very simple. I think for me, it was important to do a few, probably tested it for about a month, all the templates. And then after that, it was like, okay, I don't like this. I'm going to remove this. I'm going to change this. I'm going to add this. And then you make it as personal as you want them. Okay. So we have a temp here. Let's say her initials are LB. Patient is not happy with the smile. Again, medical history, social history, intraoral. Okay, So here, for example, we just delete this because it's not relevant. So it's very easy to do, okay? And this is what I really like because it's so easy. What is the patient? Skeletal is presenting with a class 2, is moderate. The FMPA is low. Let's go with all this. It's very, very simple. And basically what I do is as I'm saying, and as I'm doing it, or I'm doing the check, the assessment, my nurse is just clicking buttons. So they love it because it's not that they have to go class 1, class 2, div 1, class 2, div 2. It's basically just pressing a button and everything will come very easily. Okay, so I'm just pressing buttons here. I'm pressing buttons here, and so you can see how easy it is. You said the overjet is 2 millimeters. You just go to the 2, simple as that. Your right side is, let's say, a class 2, just a quarter. Then the other one is a class 2, but it's half a unit. So it is super, super easy to do. Your overjet is, let's say, is reduced and is complete to tooth, or it could be complete to palate, if let's say it's a very deep bite. Midlines, are they coincident or they are deviated? If they are deviated, how many millimeters is to the right? You just go to and press right, okay? So the nurses find it super, super easy to do the notes. Then I go and said, no upper bites, no cross bites, no spacing upper or lower. The crowding is moderate. Let's say the lower one is severe. And is there any other findings? Well, you can say yes, or you can say no, whatever it is. So let's say implant lower right 6. Okay. So it may be that you just seen this patient for a checkup last week. So the intraoral exam is not relevant. So you can just delete the whole section. Okay. Let's say x-rays are not relevant. You just press that. Then you have here your problem list. Very easy to find everything. What are your treatment goals? For example, you can say ideal is class 2, div 2 to class 1, reduce overbite, and resolve crowding. But you know that there may be a compromise. Sorry, I'm not, it's late at night. Compromise, and it already highlights that is another kind of list. Can you see here? So it's very good. Let's say that we're going to improve the class 2, div 2, and that you are going to improve the overbite. Okay, so you discuss this. This is the things that I normally discuss with my patients when we are talking about Invisalign. You just add whatever you want. You want to add something, you just put the add line. You want to delete that one, you just get rid of it. Okay? And then we do a summary of the ortho assessment. So let's say that is a 40-year-old female. We said it's a class 2 div 1 or class 2 div 2 with a skeletal class 2. The FMPA was reduced. And what are you going to do? So, okay, it's a full complex. This is my, I do this like that. For you, maybe only I7 light and full. I do full complex and full complex severe, depending on obviously the complexity of the case. Let's say that we want to extract the upper 8 so we can help with the class 2. The patient is aware that extractions are recommended for the ideal treatment of the results. And then let's say that we said to a patient is going to be about 18 months. And that's it. You just go, copy, and paste. So it's very, very straightforward. I'm going to take another 2-3 minutes of your time because I really want to show you the BACD consultation template. It has a lot of information, but not everything will be relevant for you, okay? And that is the beauty of this BACD template, because it can have everything if you're going to do a full mouth rehabilitation, but it has the potential to make it as simple as possible. Let's say you're only going to do bonding for a couple of teeth. You can still use this template and just with this cross, you just delete the section, okay? So let's say the patient comes by itself. What is the patient's concerned about aesthetics? Okay, has short teeth, wants to add it. The patient has previous ortho, let's say yes. About 1 year ago, he had aligners and is on removable retainers. So it's very, very easy. Just gives you the question without you having to think about it. Okay, so let's say there is nothing wrong with their medical history. Let's say you've seen that patient before, you know that the social history, you just delete it. The brushing and cleaning, you've seen the patient, you just delete that section. It may be that you have done already an ortho assessment. If that's the case, maybe you don't need to do this. But if in this case, let's say it's relevant, you just basically click as is the case, okay? So let's say the smile arc is flat, the vocal corridors are narrow, but you can add and remove as you please, okay? So let's say the patient is just showing 1 millimeter of incisal edge. It has a competent lip. It doesn't have a lip catch. So you see, it goes into a lot of detail, but maybe not everything is relevant, okay? So let's say here the patient had some Botox or some lip fillers. So then you can just say, well, the patient had lip fillers about a month ago. So is it swollen? Is it needs to be reduced, the swelling? So, you know, all these things that you can see. You see the patient for exam, so we can just delete this. We're not concerned about the perio. We know it's a healthy periodontal. We have it in our order notes. We just get rid of it, okay? So it's as simple as that. You can do an occlusal assessment. If you are going to do some fixed restorative, if you're going to do some mouth rehabilitations, of course, these occlusal assessments are essential. Even sometimes to do bonding, we need to do it in order to give the patient the best possible result. So you just have the tools here, okay? You just have the tools, you just click. I'm just clicking, just right clicking. Let's say we know the patient is fine, the smile assessment. So you just click, patient said they were small teeth, so let's put narrow, the satisfactory. So it's just adding information to there. Then we have x-rays, we have already seen those ones, we get rid of them, okay? But it's as simple as just clicking some buttons, and that's it, okay? So we almost finished, I promised. You go into the diagnosis, you can add all these things, you can add order, and then you just write your notes, okay? Whatever you discuss with the patient. Of course, in these cases, the discussions are very individual, so it's not going to give you, like, you know, discuss gingivitis or discuss the origins of tooth decay or anything like that, because it's obviously relevant to what the patient came to see you for, the cosmetic concerns, okay? So then here you may decide to do that. You're going to do crowns on all the teeth. So you tell them what is the type of crown that you discuss. It may be that at this point you don't know. So you just get rid of that. And then here you can set a replacement of all existing crowns or whatever it is. And then we just write things or click things more than anything. Okay. So we're going to do some home whitening, and the next visit is going to do the small design. For example, you just click small design. Okay. And that's it. Basically, you copy again your notes. And as you copy these, you just go and say paste, and it goes into your notes straight away. At that point, you can read it again. I normally what I do is if I have 2 or 3 windows open, I will go back to the first one and check again. Am I happy with what I put? Check the x-rays again. So you can go back to the appointment, to the notes. And you didn't want this one. You put Neil and it was something that you needed to change that. So you just go back and it gives you the option again, okay? But you want to redo it, you just click that, you just copy your notes, and voila. So I hope that you find these interesting. I know I cover quite a lot with these 3 templates, but I just want to give you an overview of what you can actually do with Kiroku. And there is lots of templates. There are templates that I use regularly, as you know, like the basic exam is something that I do a lot, as well as Invisalign assessments. The BACD, I've done it 34 times. So there are templates I use a lot, and there are others that probably are not as needed to me, but you just go in and you just explore what it is. And if there is anything you want to change, you just change it. Okay, so thank you very much for your attention. And I handle you back to Hannah. So she's going to tell us about the other documents that you can use with Kiroku.
Gina, thank you for going through that with so much enthusiasm and showing those different templates. That was awesome. I'm sure that's really appreciated by everyone who is attending. I will take over and share my screen. Let me continue there, and hopefully I can, let me just double check I'm sharing the right screen. Hopefully you can now see my Kiroku screen. And I'm not going to go through and do a full set of notes, but of course, just to be clear, the creating a document is done when you've got a completed set of notes. So if you imagine the end point that Gina got to with the Invisalign assessment, where it came to copying and pasting into the practice management system, you'd be still doing that. You'd be copying and pasting your notes over. But once you get to the end of the notes, you then have the ability to create these documents as well. And so these are for templates, notes templates that have got documents attached to them. So you'll see from these little symbols, these red symbols in the corner, that's when there's a document attached to it. And so once I get to the end of that template, it would then give me the option. So you can see my Invisalign assessment one does have one attached. Now, instead of watching me fill in a set of notes after Gina has done it so well, I'm just going to go to a draft. So in the same way that Gina had several windows open just to be able to come back to them, you can also save things to drafts and then come back to them later if you would like. And so this is an Invisalign assessment that I have gone through and filled in, and so you can see that that is everything completed there. So I would then be copying, pasting that over into my practice management system, but then you'll see that we've got this end point where it says generate Kiroku docs. And so here I can select that I want to create a patient letter, so that at the end of my Invisalign assessment, not only are my notes done, I've also got a bespoke patient letter going out to my patient, so they're fully aware of what needs to happen. And so once I've clicked that button on the left, you'll see that's just a completed set of notes on the left. And then you'll have areas where you can fill in certain variables. So if you want the patient name on the letter, you can just pop that in. Of course, you would want the patient name on the letter, but it might be that you want that added by your TCO later. So it might not be something that's necessary for you to add. It's totally up to you and how you work. If you are able to do everything end to end on Kiroku, you'll see some of the benefits of additional features you can use. Let me just quickly move my Zoom screen. So on the right, you'll be able to see this completely tailored letter for the patient. So it's got a write-up of, what they're doing for their oral hygiene. Following examination, we found your oral hygiene was good. You're currently brushing twice a day with an electric toothbrush. So it's completely customized to this patient. Their treatment plan, information about Invisalign and a possible, you can, and here we've included a kind of infographic. You might actually want some of your own cases to be coming out in the letter. So in the same way that the templates are completely customizable, these documents are completely customizable as well, either per patient, because you want to go in and type something specific to this patient, in which case you can do those edits very easily, or actually you can change the structure as well. And so again, you can see that this can pull out all of the, relevant risks and things like that. And then my own details at the end. And you can also do e-signatures through the Kiroku platform now as well. So if you then go to send this to the patient, you can send it just as a PDF, or you can send it as a track document. If you're sending it at all, I would recommend doing it as a track document, because then you've got the ability to see if a person has viewed this document. So when they come back in for their, let's say, their ClinCheck appointment, you've got a really good understanding of whether they've engaged with the patient information you've sent out, but you can also get digital signatures back through the platform as well. However, that might not be how you work. You might have a TCO in your practice, and you might just want the letter to be created and then just sent to the TCO to be sent to the patient and added to the practice management system, in which case you can download it as a PDF or a Word document and then send that to the relevant person in your practice. And so that is the system. I won't actually show you in detail how to edit it, but I do just want to show you very briefly the ability to edit it, just so you're aware. So here, let's say, if I edit this template, you can see that you can pull out loads of information from the set of notes. So you can say, if I've selected this in my template, my notes template, output this information. So if the patient's a smoker, I want this information to come out. If they're not, I don't. So you can make sure that you're building in this really, really bespoke patient treatment planning letter. And it really is kind of belts and braces consent, because it's so informative and bespoke to that patient. I hope that's been helpful.